Thank you, and thank you for the invitation. Now we talk about glaucoma secondary to vitreoretinal surgery. The question, sorry. Okay. Actually, the question also nowadays is if it does vitrectomy increase the risk of developing ocular hypertension or open-angle glaucoma. Because, and this is because of contrasting definitions, heterogeneity of population, variation of surgical techniques, risk of bias, and then what is very important is the presence or less of endocular tamponade. In particular, secondary glaucoma prevalence due to permanent intraocular tamponade is estimated about 18%. In most of cases, it is caused by trabecular meshwork block after emulsion of infiltration, and the risk factors for this of course, is secondary is pre-existing hypertension or glaucoma, diabetes, anterior chamber tamponade, buccal and long-term tamponade. We know that silicone oil tamponade could create, for different reasons, or early ocular hypertension, but also late ocular hypertension. Also, gas tamponade could create glaucoma, and this occurs actually in the early study after vitrectomy. In these cases, treatment is considered face-down positioning and bubble aspiration where necessary. About 10 years ago, Stalin Chang was the first who defined the oxidative glaucoma. That is a glaucoma, secondary glaucoma, after non-complicated vitrectomy. And he postulated that the lens could play a protective role by metabolizing most of the oxygen from the vitreous chamber. And this study was created to understand which is the mechanism, the pathogenetic mechanism of this glaucoma. He divided 3 groups: one suspected glaucoma, another one new onset glaucoma, and the third was the pre-existing glaucoma. The conclusion is that there is an increased risk of hypertension and glaucoma after vitrectomy, maybe for a damage due to the oxygen that penetrate in the anterior chamber. This oxidative damage could increase the level of oxygen and then create damage of the trabecular meshwork and also an alteration of the outflow. For the physiopathology, this concentration of oxygen could activate inflammation cells and then formation of free radicals and induction of apoptosis that create alteration of the trabecular meshwork. But what we ask nowadays is really if vitrectomy could increase the risk of developing this pathology. Because in literature we can find a lot of works on a lot of study and contrasting results. For this reason, recently has been published in a review that was born from the collaboration from the University of Florence and the University of Varese, and it was a meta-analysis that analyzed as outcome, primary outcome, the incidence of glaucoma after at least 1 year. And the secondary outcome was the presence of hypertension after at least 1 year. Investigating the incidence was very, very difficult, and many studies were considered, but only 7 and also non-randomized study were considered as what we were reaching. And risk of bias assessment, also variability of definition, data collection were considered. This is the analytic results that, as you can see, have found an incidence in vitrectomy of 7.8 of glaucoma versus 4.8 in the fellow eyes, with a node ratio that was significant also because of a little heterogeneity. And about hypertension, there were a difference, but this was not significant, caused by a large heterogeneity. And also the mean IOP after 1 year was considered, and is not increased in vitrectomy versus observed eyes. So the conclusion of the study were that we found an increased risk of glaucoma, also if estimates was imprecise, and the mean IOP does not differ between groups, and the quality of the study was very suboptimal. Surprisingly, we find an incidence of glaucoma after vitrectomy that exceeded the hypertension, but we have to consider that the morphology of optic nerve and RNFL thickness could be modified after vitrectomy. So, is it true that there is a greater risk of hypertension or glaucoma after vitrectomy versus fellow eye? We don't know, because difficult interpretation of results due to variability in population definition and reporting are very demanding. Here we can see an ILM peeling that, as we know, create optic nerve morphology and thickness modify, and also a typical central visual field defects. So in conclusion, we have to differentiate what is a hypertension from glaucoma after vitrectomy. And we can see for sure that vitrectomy is a risk factor for the development of an hypertension or glaucoma, where tamponade shall be used for sure with silicone oil. But many confounding factors make it difficult to assess causality. And so further multicentric observational research is recommended. That's it.
L'argomento sarebbe interessante, bisogna discutere a lungo su glaucoma e vitrectomia. Se qualcuno vuol fare una domanda, dal momento che siamo in ritardo, anche dal pubblico, qualcuno vuol chiedere qualcosa su questo rapporto glaucoma-vitrectomia, che è tutt'altro che poco importante, perché